Orthopedic health information brought to you by Professional Orthopedic Associates.
One common question that comes up regarding ACL or anterior cruciate ligament reconstruction is, where do we get the graft from? Since we need to use a piece of tendon tissue to reconstruct the ligament, there are different options. First of all, none of these options have been found to be significantly improved one over the other. But there are different risks that occur with using different types of tissue. The initial decision that needs to be made is whether to use tissue from your own knee or tissue from someone else's knee. Okay? Your own tissue is called an autograft, whereas tissue that comes from a cadaver or someone who's donated their tissues is typically called an allograft. When you use an autograft, that means your own tissue, there are certain advantages of doing that. The advantage is that it's your tissue. You don't have to worry about where it comes from or typically infections that might come from that type of a graft. The downside of using your own tissue is typically that there's some added time to the surgery, usually short, about 15 minutes or so. Also that there is some morbidity or increased risk that goes along with using your own tissue. Certainly there's a little more pain in the early stages, but oftentimes with the anesthesia techniques that we use these days, that pain is typically negligible. And by the time you get probably 2 weeks after the surgery, it's no different than using tenon that comes from a tissue bank with regards to that type of post-operative pain. Typically the grafts that come from somebody's own knee, for many, many years the gold standard was considered a bone patellar tendon bone graft. This is a graft that we use from the front of the knee over the patellar tendon, which connects the kneecap to the lower leg. Of course, that's a very important tendon for our leg, such that taking that, we can't take the whole thing. We have to leave a good portion of it to be able to extend the knee. So these tendon grafts are typically taking a third of the patellar tendon along with a piece of bone from both the kneecap and just below the knee. The incision tends to be a little bit longer. The initial postoperative pain tends to be a little bit higher. But this was typically felt to be our gold standard, particularly in the 80s and early 90s. Many of us have gone to using soft tissue grafts that come from the knee to help decrease the amount of postoperative pain people have and to speed the recovery. One of the grafts that we typically use nowadays is called the hamstring graft. So we know that our hamstrings are in the back of our thigh, but they do connect into the lower leg, the tibia, just below the knee joint. Through a very small incision, usually about a little less than an inch, the hamstrings can be harvested. So what we do is we steal 2 of the hamstring tendons, we strip them into the back of the thigh, and we use those to kind of recreate our anterior cruciate ligament. The advantage of this is that the incisions are smaller, the amount of postoperative pain has been less, and we found better techniques nowadays to fix these this soft tissue grafts within the tunnels in order to give people a very strong ACL reconstruction. I also mentioned that you can use allografts. Allografts are tissues that come from a tissue bank. Typically these are not like transplanting a heart or a kidney, which are live tissues that we place from one person to another. Because of that, we don't need to worry as much about graft rejection. They don't have to be perfect matches in order to transplant these from one person to another. As I've stated previously, any of these tendon grafts, even tissue grafts that come from yourself, are dead tissue that are going to be replaced by your body's ability to use it as a scaffold to build new tissue into. So that even with an allograft tissue from someone else, your body's going to replace that. So rejection is not something we worry about so much with these tendon grafts, but disease transmission is certainly a concern. Even with the testing that we have in this day and age, that there are certain windows where people will donate tissues, but we won't pick up certain diseases. The diseases we worry most about are bloodborne diseases, such as hepatitis C and HIV or AIDS. These are testing. There is testing that we have for these types of diseases, but in these grafts, there are windows where we could potentially miss that. With hepatitis, there's probably a 1 in 500,000 chance of disease transmission with the use of an ACL allograft. With AIDS, it's certainly much less than that. Some people say it's between 1 to 2 million disease transmission risk. So it's small, but it's certainly not negligible, and this often drives people to utilize tissues that come from their own knee. As well, although we've seen excellent results from all types of these grafts, we do know that using your own tendon tissue probably speeds the recovery process from a standpoint of the transition back to having a normal ligament. In other words, your body replacing that tissue with its own normal tissue. So that we feel that the time frame with which an autograft or your own hamstring tendon or bone patellar tendon graft will be at risk for re-injury is a little bit shorter than with an allograft, which takes a little bit longer to reincorporate inside the knee. So some reports have suggested that the re-injury rate in that first year or so may be a little bit higher with the use of an allograft. Oftentimes we take all of these factors into account with regards to making these decisions for our individual patients. Certainly you need to be dealing with a surgeon who's familiar with the use of these tendon grafts and what might be the best type of tendon graft for each person. In conclusion, anterior cruciate ligament injuries are a big problem in our society with regards to our young athletic population. The good news is that through the advances of medicine, we've been able to solve these problems and return the vast majority of our patients back to an active lifestyle, as well as the ability to return them to every level of sport, at high school, collegiate, and even professional level, despite these types of injuries. So that if you suspect that you've had this type of an injury, you'll want to seek out care from a trained board-certified orthopedic surgeon. You'll want to look for an orthopedic surgeon who has specific focus in treating these types of injuries. Usually that's a sports medicine specialist who is involved in arthroscopic and both open care of knee injuries specifically. Thank you for your attention.
This has been Orthopedic Health Information, brought to you by Professional Orthopedic Associates.